Let's move on, get to a story. And I realize this is not necessarily going to come as a news story, but interesting that it gets picked up in, of all places, the Globe and Mail. We know the serious issue as far as healthcare in this country clearly is concerned. We know about family doctors and how bad it is. And I guess we knew that Quebec, was bad. Mm-hmm. But when the headline reads, "Why Quebec's family doctor crisis is the worst in Canada," that bears, I guess, talking about and trying to get some more details on. So Dr. Claude Rivard is a family doctor in Ste-Julie and a member of Quebec's Federation of General Practitioners. He's on the line right now. Dr. Rivard, thanks for your time this afternoon.
Pleasure.
I want to begin by asking the obvious question here. As much as we talk about this, and we have been, of course, COVID has obviously made things worse, or at least it's made things, put them more in the spotlight in terms of how understaffed we are. This has been going on, I'm going to say, for close to 30 years, has it not? We've always talked about this here.
It's been going on for more than 40 years. It's usually Quebec doctors always had more, like the proportion of their work was always more important than other family physicians in other provinces. Like about 40% of our shift of our work is done at the hospital or long-term care, but it's outside the medical clinic. So if you have, and in the rest of Canada is about 20%.
So that's by design. That's the way the government here set this whole thing up.
That's the way it's always has to be. It has been like in the last 30, 40 years. So we had more than our share of work, hospital work to do. We have something like 10,000 family medical practitioner here in Quebec, and about 2,000 of them are working at the ER, and about the same amount are doing hospital work, like taking care of patients. It may be adult or even pediatric population. So, and we also are doing, like right here in the Sault-Ste-Julie, about half to 2/3 of all the deliveries. So, and we take care also of the long-term care institution. So the amount of work that is made in like second line institution is more. It's twice than what the other family doctors are doing in the other provinces of Canada.
So then, Dr. Rivard, I have to ask the most obvious question. Right. Why? If it's not working, why are we sticking with this system? Well,
it's you cannot, like, it's not the yak. It's more like a destroyer. You cannot turn things around as rapidly as you want or you can. It's something that's been going on for a few years. Like, in fact, the last 20 years, we've been mixing or like shifting the work. Like 20 years ago, there was not a single specialist in ER. Okay, right now it's a new specialty. So some physicians are choosing an ER specialty, so they cannot do other thing than ER work. Usually, a family doctor, when he start working, he has a mixed balance of work. So he's doing hospital work, like say a week every 5 weeks or 4 weeks. He has hospital shift to do to the hospital, or like when I started 25 years ago, I used to do 1 to 2 shifts at the ER per week, and the rest of the days of the week I was seeing my patient at my clinic. So it's kind of a mixed work like that. And to be frank, doctors like to have at the same time first line work with the second line or hospital work. That's it. Because you work with the specialist, you have rapid access to radiology, rapid access to labs, and you keep yourself, let's say, at the level for the care because the specialist is there. In other provinces, when a patient is hospitalized, he's not under the care of most of the time, he's not under the care of the family practitioner. Right. He's under the care of the specialist. and it's a system, and we have more than 20,000 physicians in the province. So a lot of the specialists who are taking care of people at the hospital in their provinces the specialists here are not unless they're in a university or a specialized hospital, they're not taking care of the patient at the same, let's say, percentage of or level of work than other specialists in other provinces.
No, I get that, but so you seem to be kind of making the point that as bad as it's spread out or thinned out that the medical practitioners are here in Quebec because of that extra work they have to do in different venues. That's part of the problem. What's the rest of the problem? Because I imagine we keep hearing more and more doctors are leaving. They're retiring. They're simply getting older, and there are not enough doctors to replace them. Is that part of what's going on as well?
Yes, that's the main problem. Is that right now about a third of the doctor are over 55, 60. So and they take in charge more than their fair share of the patient. Like I have 1,400 patients.
Oh my gosh.
Some doctors, like my age at 62, have more than 2,000 patients.
Wow.
And when we going into retirement, it takes 2 or 3 other physicians to take our caseload. Because the young one, when they come and they start doing the first year of their practice, they also have to do hospital work. And in the last few years, hospital work and long-term care has taken a really big share of our practice. So because their shift is now 3 to 4 shifts per week at the ER, or their shift that has to be done at the hospital is not once every month, but twice every month.
But
they have less time because there are more patients that has to be taken care of.
So it's hard to imagine, but things are actually going to get worse then. Some
doctors, what we're trying to change that, and what we're trying to do is that repartition of the doctors throughout the province has to change. We're going to make some suggestions to the doctors. The fact that a patient has to be registered to a family physician. We want to change that also, and we want to see if a group of family doctors with nurses would not be able to provide better coverage to a bigger number of patients.
Yeah.
So instead of having a patient being inscribed or let's say registered only to one physician, then he's going to be registered but to a group of physicians. So this may change the way we practice medicine. And there's also a shift that's going to happen is that the specialist and the other specialty, they will probably have to increase their share of beds that they have to take in charge. And it's already started in the hospital. So the other physician, like specialists at the hospital, they're going to take 10, 15, 20 beds at their name, and they're going to be the physician in charge, responsible for the hospitalization of the patient, not family physician anymore.
Well,
we want to decrease our charge to, let's say, about 30%.
So we know the government is listening. We know that idea of groups, as you're just describing, is something they're thinking of. We can only hope that it actually goes from an idea to something that gets put into practice, because clearly something needs to change. Yeah. Dr. Rivard, I want to thank you so much for your time this afternoon. We appreciate it.
Pleasure.
Dr. Claude Rivard, family doctor, and Globe and Mail headline, worst in Canada, Quebec.